PCT. I was diagnosed about 4 years ago, and in the past 2 years, I've only had to have two phlebotomy treatments. Are there any reports of PCT going into remission? And is there a clinical drug I can take to help with sun exposure?
So PCT, Porphyria Cutanea Tarda, is the only one of the porphyrias that can develop in the absence of an inherited genetic mutation. Okay, and the reason for that is because the enzyme that is partially defective and responsible in Porphyria Cutanea Tarda is an enzyme called uroporphyrinogen decarboxylase. It's an enzyme that works primarily in the liver, and patients who have other kinds of liver diseases, alcohol use, people with inherited defects in iron metabolism, who have iron overload, for example. All of those patients can develop Porphyria Cutanea Tarda without having an inherited a mutation in this UroD enzyme. Okay, so Porphyria Cutanea Tarda, the best form of treatment, there's two. The first way is phlebotomies. So it turns out that PCT, iron accumulation in the liver is really important for inhibition of the UroD enzyme. Phlebotomies work really well to normalize the iron levels. And then an anti-malarial treatment, chloroquine or hydroxychloroquine, also works. And we use it at much lower doses than what is used to treat malaria. That medication works slightly differently. It doesn't lower iron levels in the liver. It actually gets rid of the porphyrins that are accumulating in the liver first, that then sort of, then distribute out to the body and cause the skin symptoms. So both of those medications are really effective for treating PCT and then preventing the blistering skin lesions.